I first found out that something wasn't right when I had my first ultrasound.
Before Matthew Gavostis was even born, he faced more challenges than most of us. The left and right ventricles in his heart were reversed, and his parents were referred to Boston Children's Hospital.
They said his condition was so rare that it happens in only about 0.1% of all heart patients.
The stronger part of the heart was doing less work, and the right heart was forced to do a lot more work than it was designed to do.
Matthew had a normal birth. Outwardly, you would never know he had a problem. But surgery was almost certainly in his future. And for several years, the doctors at Boston Children's kept a close eye on him.
When Matthew was about 4 years old, he began to develop a very small amount of dysfunction or lack of squeeze of that right ventricle, and that prompted the team to consider a proactive operation.
Matthew would need 2 separate operations. The first was to strengthen the heart's ability to pump. In the second procedure 10 months later, doctors switched the arteries connected to the ventricles, so both ventricles could do the jobs they're designed to do.
The second operation is called a double switch operation, which basically is when the surgeons switch the inflow and the outflow of the heart, even though the ventricles themselves have to stay in the same position.
But 48 hours after that procedure, Matthew went into respiratory distress.
It was very scary. It was horrible. I mean, he had a hard time breathing. His lips were discolored. It was pretty much an emergency situation.
The doctors at Boston Children's were able to save Matthew, but in spite of their best efforts, a transplant was now his last option.
We were shocked because, we thought we were going to avoid all this. Basically, doing the procedures that we did, we thought that this was going to help him not need to be in that situation. And really kind of just felt like it was our fault.
But Matthew is in the right place. Boston Children's is the only pediatric transplant center in New England. He received a new heart in January, and he's doing great.
Dr. Smoot was fabulous. She was wonderful with Matthew. She was wonderful with us. And the whole transplant team that they have was just so easy to reach. If you had any question whatsoever as we were going through this process, they were there.
For the most part, I think his prognosis is fantastic. Being there and seeing those kids that were sometimes so very sick, and then seeing them 5 years later, 10 years later, it doesn't get better than that.
Matthew is amazing. He's in second grade. He's 7 years old, and he's out playing soccer, basketball, baseball. He's just, one of the kids.
During his hospital stay, the New England Patriots paid Matthew a visit. And now, Matthew really knows how to celebrate a victory.
Touchdown!